Today, I'm going to fill you in on 5 must-know facts about Buspar. And fact number 1 is that this medication was initially developed as an antipsychotic medication because of its mild dopamine blocking capabilities. But when being studied, they found that it was pretty crappy at controlling psychotic symptoms. What researchers instead found was that it was helpful in reducing anxiety symptoms because of its effects on the 5-HT1A receptors, which are the serotonin-based receptors. Therefore, it was FDA approved for the treatment of generalized anxiety disorder, and when it first came out, marketers advertised it as being able to provide a different kind of calm because of its unique differences from the other more typical anti-anxiety medications. Fact number 2 is that Buspar needs to be taken 2 to 3 times per day to be effective. I have seen so many patients who are only taking this once per day, and then they wonder why it's not working. The half-life of this medication is only around 3 hours long. And in order to maintain stable drug levels in your body, 3 times a day dosing is what was initially recommended by the manufacturers. However, there was a study that found equal benefit with twice daily dosing, which is much more doable for most people. So when I start someone on this medication, I usually will start them at around 7.5 milligrams twice daily and then gradually increase the doses needed over time. The max recommended dose is 30 milligrams twice daily, so 60 milligrams total per day. Must-know fact number 3 is that Buspar is safe and generally really well tolerated for most people. Whenever I have patients who struggle with SSRIs or SNRIs, switching them to Buspar helps. Its main side effects are headaches, nausea, and dizziness. From the safety standpoint, something that is really interesting is that when researchers were looking at using this medication as an antipsychotic, they studied doses as high as 1,200 milligrams per day. So the risk of harm from overdose is lower with this medication compared to others on the market. Fact number 4 is that Buspar is one of the safer options for those with anxiety who are pregnant. It falls under the pregnancy class category B, meaning that animal reproduction studies have failed to demonstrate a risk to the fetus, and this was at doses of approximately 30 times the maximum recommended human dose. But keep in mind that there have not been adequate or well-controlled studies performed in pregnant women. With that being said, a pregnancy class category of B is better than most of the antidepressants out there that are currently being used. For example, most SSRIs and SNRIs are class C or even D, and then most of the benzodiazepines are class D or X, so much less safe than Buspar. Must-know fact number 5 is that Buspar can help reverse sexual dysfunction and bruxism caused by SSRIs or SNRIs. With sexual dysfunction, there was a placebo-controlled trial that showed it was helpful in improving sexual side effects caused by paroxetine or citalopram. These effects were more pronounced in women than in men, and dosing for this medication was between 50 to 60 milligrams daily, and this is usually divided into twice or 3 times daily dosing. And then bruxism is a medical term given for teeth grinding. And I actually didn't know until recently that some of the SSRIs and SNRIs can have this as a side effect. I never saw it during my residency or fellowship training. But then once I was in private practice, one of my patients actually developed this when taking Prozac. And there have been multiple studies that have found that adding Buspar to someone's medication regimen was helpful in reducing teeth grinding. Now, if you're looking to learn more about Buspar, make sure to click that next video.